For more on what healthcare workers are bracing for, we're joined by ICU physician Dr. Hassan Masri in Saskatoon. Dr. Masri, there are 11 people with COVID-19 in Saskatchewan ICUs at the moment. What do you expect to see at hospitals in the coming weeks?
What we expect to see in the next few weeks is what we are seeing in other jurisdictions in Ontario, Quebec, and other countries like we saw in South Africa and in England, where there are increase in the number of visits to the emergency department. Some of those visits will end up in patients being admitted to the general medical floor, and some of those visits will end up going back home with some medications and some further care. What we're going to watch for is that what is the percentage and what is the number of people who get admitted and eventually make it to the ICU. This will be really the factor that will determine how severe and how painful this wave will be.
So what kind of COVID patients do you expect to see in the hospital? Who will get sick and how?
What we expect to see is that most folks who are unvaccinated are going to be the people who are going to have increased visits to the emergency department, increased admissions to the hospital, and possibly admissions to the ICU. We know that from what we've seen so far in the previous variants, but we also know that from the people that that have been admitted to the hospital in the last in this current wave in other jurisdictions and in other countries.
So there does seem to be some confusion about the severity of the variant. On one hand, health officials say Omicron is a milder strain. On the other, we're seeing hospitalization increases dramatically in some places. How do you explain that?
You know, the term mild or not severe is really has to be put into perspective here. Mild is in relation to the Delta variant, which was extremely severe in attacking the immune system, attacking the lungs, landing people in the hospital, and even having fatalities and death. So it is not mild in the sense that it is a no problem and that we'll have no issues with it. It's mild when compared to the Delta variant. The other thing, it is mild in those who are vaccinated. We know from other jurisdictions, as I mentioned, that it is not mild at all in those who are unvaccinated. And so, communication and using this term mild has to be done very carefully. Otherwise, we will give people the wrong impression that this is something that they have nothing to worry about. But it is indeed something that we have to worry about. We're more careful when we understand these terms, and we're more careful when we understand the facts. And I think understanding what mild means is extremely important.
So both the Premier and Chief Medical Health Officer have said a fifth wave cannot be avoided. What do you think we can do in Saskatchewan starting now to curb the spread of making it less harmful?
That is correct. This fifth wave will take place, and our job is to blunt this wave quite quickly and quite aggressively and not wait like we have done in the fourth wave few weeks and then act, because then it will be too late. 4 things that we need to do immediately. Number 1, we need to make sure that booster shots are available a lot more than they are right now and that people are getting them. Number 2, we need to use these home antigen tests quite aggressively and make sure that they're available for everyone and that people are using them. So if I'm being tested every day and you're being tested every day, then if we find ourselves positive, we're less likely to engage in a social gathering and infect 30 or 40 or 100 other people. Number 3, we need to be able to have a plan. The school started today. We seem to be the only province in the country that had no delay in start date of the school and no plan in how to deal with this rapid transmission. This is very problematic because we know that social gatherings, including schools, are where the transmission is happening. And number 4, and we don't talk about this enough, but masking. We know that masks are extremely effective. Arguably, one of the biggest problems that Saskatchewan has faced in the fourth wave was the fact that we have gone all summer long and all the way until the end of September with no masking mandates. And so masking and enforcing it and making sure that people abide by it is extremely important to blunt this fifth wave and to make sure that this fifth wave is not as painful as it can be, like we're seeing in Quebec. So those 4 things need to be done immediately and effectively to hopefully blunt this wave and not face the consequences in a few weeks.
Thank you so much for your time today.
Thank you so much for having me.
That's Dr. Hassan Masri, an ICU physician in Saskatoon.